Good afternoon. My name is Kathy Hickey, Program Coordinator for Mass Family Voices, a project of the Federation for Children with Special Needs. We're so glad you are able to join us. Today's webinar is entitled Making Sense of Healthcare Financing and will review how to access MassHealth and its benefits. This webinar will be recorded and archived at a later date on the Federation's website. A few technical pointers. Please be advised that everyone will be muted except our presenter. If you have any questions, please use the webinar toolbox that allows you to type in questions and we will answer them either during the presentation or I will collect them for the question and answer portion of this webinar, which will follow the presentation. If we are not able to answer all the questions, we will respond by email following the webinar. This webinar will be presented by Tracy Rooney, our Health Information Specialist at Mass Family Voices. And thank you to our IT Director, John Sullivan.
Good afternoon. We're coming to you today from the Federation for Children with Special Needs located at the Schraff Center in Charlestown. Most of you are probably familiar already with the Federation. It has a very significant impact every year on families. As you probably know, we assist approximately 40,000 families per year, responding to numerous phone calls in our various call centers. We maintain a website which has resources on health, special education, transition, as well as many other topics. There's an annual Visions of Community conference, which will take place next year on March 4th of 2017. We present workshops like this one, publish a quarterly newsletter, the Newsline, and that can be distributed both in hard copy or by email and is available as a link on the website. And we also are on social media through Facebook, Twitter, and YouTube. Our project, Mass Family Voices, the Family to Family Health Information Center, is one of 15 projects of the Federation, and it is one of 51 federally funded family to families throughout the country. Our focus is on families as well as the providers who support them, and we provide information, support, and assistance by giving families the tools that they need to make informed decisions, to advocate for improved public and private policies, to build partnerships with professionals, and to serve as a trusted resource on health. You can see in red the sources of our funding. And our services include a toll-free number. If you call the Federation's main number at 800-331-0688, we're at extension 301. We hold an annual Joining Voices conference, which is coming up on November 3rd of 2016, and you'll see a link on the Federation's website. We hold webinars like this one, and maintain a listserv with over 800 families and professionals who participate very actively in sharing information and also being a resource to one another with questions. We hold healthcare workshops at the annual Visions of Community Conference, which is held by the Federation each year, and that's in March. And we present workshops throughout the state. Who am I? I'm the mother of two daughters. My older daughter, Tess, is a typical 24-year-old. She's currently in graduate school. And my younger daughter, Kate, is my 20-year-old. This picture was taken 2 years ago at her high school graduation. And Kate struggled throughout middle and high school with behavioral and mental health issues that were very significant, led to 4 high school placements, for instance, and involvement with multiple agencies. She's doing well today. She's a full-time student, and so we're thankful for that. But she's doing well with lots of support. The goals of today's workshop are to talk about the Affordable Care Act and how it affects, and also how it doesn't affect, MassHealth. We'll learn about the different versions of MassHealth. We'll discuss who is eligible, the particular forms that need to be filled out to apply for MassHealth for a child with a disability. And lastly, we'll discuss premium assistance and how to apply. This is a brief history of insurance mandates in Massachusetts. In 2006, Governor Romney and Senator Kennedy worked together to create the Massachusetts healthcare reform. This reform rolled out in 2007, requiring all adults in Massachusetts to have health insurance or to face tax penalties. In March of 2010, President Obama signed the Patient Protection and Affordable Care Act. The ACA then rolled out in phases, and in January of 2014, the mandate required that all children, as well as adults, have insurance or face tax penalties. Massachusetts has coverage mandates, which are known as Minimum Credible Coverage, or MCC. This standard is the minimum level of benefits that must be included in a person's health insurance plan in order to satisfy the Massachusetts individual mandate. Those standards include some of these items: limits on annual deductibles, maximums on out-of-pocket expenses, required coverage of prescription drugs, required coverage of radiation therapy and chemotherapy. This slide discusses the key open enrollment dates that were specified by the Affordable Care Act. And it's a little out of date, so the upcoming open enrollment period will be November 1st of 2016, continuing until January 31st of 2017. So individuals and families buying health insurance on their own, not through an employer, can buy health insurance through the Health Connector during an open enrollment period. And there's the website. It's important to note that children who have a diagnosis or become diagnosed with a disability can apply for Common Health at any time. It's not limited to the open enrollment period. These are just some of the types, the versions of MassHealth. The one that people know most commonly is MassHealth Standard, and it has a strict income limit. This applies also to pregnant women, to children up to the age of 20, caretakers, individuals with breast and cervical cancer, and HIV. MassHealth Family Assistance is for families who don't meet the MassHealth standard, which would be 150% of the federal poverty level or below. Family assistance extends coverage, some coverage, to families below 300% of the federal poverty level. MassHealth Limited is emergency health service for people that have immigration status. And CMSP, the Children's Medical Security Plan, is simply primary and preventative care for children who are not eligible for any of the other plans. Common Health is the supplement for a child or an adult with a disability. And today we're going to be talking about the Children's Disability Supplement. Kaylee Mulligan is in the state of Massachusetts, applies to home care for children who are severely disabled and require skilled nursing home or are dependent on assistive technology. And in this case, income or assets are not counted. Parents' income are not counted. Children's income and assets are considered when determining financial eligibility for Kaylee Mulligan. So Common Health is commonly used interchangeably with MassHealth, but Common Health is the version of MassHealth for a child with a disability. And it would be typically a child who doesn't qualify for MassHealth standard simply based on income, so rather the eligibility standard is based on their disability. And many families receive Common Health as a secondary insurance to their primary insurance. Common Health will pick up copays for any medically necessary services and goods from providers that accept both the primary insurance and MassHealth. That's the general rule, that the provider, in order for Common Health to pick up the premium, the provider has to accept both the primary as well as MassHealth. There are some exceptions to this, especially in the area of ABA services and what's called CBHI, which we'll get to in a few more slides in the realm of behavioral health. So there are some exceptions. But it's good to know that Common Health will pick up copays for other medically necessary services, even if they're not directly related to the disability. So long as they're medically necessary and the provider accepts both the primary and the secondary insurance, Common Health will pick up the copays. Eligibility for Common Health is based on a disability that has already lasted or is expected to last longer than 12 months. It's important to be aware that there may be a premium that the family will be expected to pay. And that's even though the eligibility is based on the disability, there may still be a premium based on family income and family size. This premium is on a sliding scale, and obviously the higher income pays a larger monthly premium. And again, we're just to remind everyone, it's important that you need to use a MassHealth provider and that it must be a medically necessary service. Here are some examples of Common Health covered services, and I won't read all of them. These are 2 slides that illustrate some of the services that are covered by Common Health. And again, some of these might not even be directly related to the disability, but just any medically necessary services that the individual with Common Health coverage incurs. So I already mentioned the Children's Behavioral Health Initiative, which is known as CBHI, stemming from the Rosie D. lawsuit. And under this program, MassHealth provides mental health, behavioral health services to children up to the age of 21 who have a serious emotional disturbance, an SED. And that's very broadly construed to include many or most mental health disabilities. Again, it's something that would have already lasted or be expected to last 12 or more months. CBHI provides for a menu of mental health services, and there are 6 of them. Families would be eligible for any of them, but typically you wouldn't receive all of them at the same time. It's kind of a menu of services as needed. So the first might be an in-home therapist, or if the needs are greater and there are more providers involved, intensive care coordination. And either the in-home therapist or the intensive care coordinator, which are known as an IHT or an ICC, either of those can serve as a hub and refer to the other, what are called hub-dependent services. Also, children with Common Health are eligible for MCI, Mobile Crisis Intervention, which means that in the case of a behavioral crisis, a team, an emergency services team, typically of a clinician, most often accompanied by a family partner, can come to the child in crisis in their home, in the school, or in the community, rather than needing to bring that child into an emergency room. So MCI is a service that's available to any children on Common Health. The remaining 3 services that are mentioned are called hub-dependent services, which means that you need a referral from either the IHT or the ICC. And those services are in-home behavioral services, therapeutic mentoring, which is a bachelor's level clinician who works as part of the team to offer more informal supports to the child, and then what's called family support and training, and that's delivered through what are known as family partners. So those are the 6 CBHI services. Premium assistance is also a program within MassHealth, and it offers a benefit that's not linked to the family's income. So you're not disqualified from premium assistance by a high income. What premium assistance considers is the nature of your private health insurance. So if you have primary insurance through a private insurer, and if that insurance is sponsored by, typically if it's sponsored by an employer where the employer pays at least 50% of the premium and the family contributes something each month to the cost of their premium, There are some further qualifications, but those would be the general qualifications. If you qualify for premium assistance, they can help defray the cost up to $1,314 per month of whatever the family's contribution is to their private health insurance. And a further qualification is that that primary insurance must meet the minimum credible coverage, which is kind of what I was describing. They do exclude high deductible plans, and they define that as $2,000 per individual or $6,000 per family. And really the only way to know whether you qualify for premium assistance is to call them and have that conversation with them about what your primary insurance is and learn whether you're eligible for their program. So for every family, there's a cost-benefit analysis, and the formula is going to be different for each family, depending on family size, family income, the nature of your private health insurance, and the benefits that you're trying to access. So you need to kind of do a pencil and paper exercise to determine if your out-of-pocket expenses, taking all of those things into account, your premiums, the common health premium, and copays and deductibles for the services that you wish to access, if those are going to turn out to be more or less than the monthly premiums. So sometimes families might apply for common health, learn what their benefit is, learn what their premium would be, and by doing this pencil and paper exercise, decide that in fact it's not to their benefit at this time. But still, it can be a benefit to know what is available, and perhaps at a future time, if family size or income or the need for services change, then it can be worth revisiting, and you have sort of that benchmark about what it might look like for your family. Also keep in mind that if you anticipate many medical expenses, not just, for instance, that you're trying to have an in-home therapist come into your home, but if you look at the whole array of expenses that you might be incurring, durable medical equipment, surgeries, nursing or personal care assistance, which is typically not covered by private insurance. And again, very often the need for behavioral health services, you want to weigh those things against the premium that you might incur. So remember that participation in common health is voluntary. MassHealth will initiate the coverage upon determining that you're eligible, and they will send you the bill. However, it's always an option to cancel the policy, although it's important that you must do that in writing, ideally in writing and or by phone within 60 days of being notified of your eligibility and of the premium. So there are 3 steps for applying for common health. The first step is to fill out the application. This is the name of the MassHealth, the application for MassHealth Standard, the application for health and dental coverage and help paying costs. And it's available at that website. You can either print out the PDF or go to the website and fill out the application online, which is really what we recommend, because you'll create a username and password, and that will enable you down the road, if any changes are necessary, to go in and easily make changes, rather than having the lovely experience of contacting MassHealth customer service. Our tips for completing the application are that person number 1 is not necessarily the IRS head of household. It's the person who is someone in the household who is going to be available to talk and to speak knowledgeably about the family situation and the child's disability. They're going to be asking for proof of income, and it's good to be aware that MassHealth has access to multiple databases, and so they will be able to access their records through the Department of Revenue, for instance, and be aware of your most recently filed taxes. So if there are discrepancies between what you report on the online application or the PDF copy, if it doesn't line up with the information that they have, they may ask you to submit more information. It's always a good idea when you're making applications to make copies of those applications and the paperwork that you're submitting so that you have copies for your own records. You want to keep track of the dates, and also write down any names and dates of people that you speak with over the phone. if you can get their extension, their title, at least know what department they're in, so that you can answer that question if you're asked later, who did you talk to? Step 2, you're going to fill out the Child Disability Supplement. And while Step 1 is best done online, the Child Disability Supplement, Step 2, has to be done in hard copy. So that's a link to the PDF, and it's a 16-page document. The first 6 pages are the application itself. The remaining 10 pages are copies of releases of information, 5 2-page release of information forms. So you're going to fill out as many of those as you think will be helpful, at least 2, but as many as you feel will be helpful, where you're happy for MassHealth to have permission to speak with those people about your child's disability. The disability determination process is separate from the MassHealth application. And so it's going to be mailed, and you'll see on the form, it's mailed to Disability Evaluation Services in Worcester. Again, in hard copy, the 6-page application, the copies signed and dated releases, as well as any documentation that you might want to provide that helps to substantiate the child's disability. Also, that 6-page form allows about 4 lines for you to describe your child's disability, and you can feel very free, as our tip suggests, you can feel very free to attach another sheet of information to make as complete a statement as you want, to explain how the child's diagnosis, because this is what they're looking for, how it limits his or her ability to participate in home, school, and/or the community life in a way as much like his or her peers as possible. So that's the key to the eligibility determination by DES. We recommend that after you've completed the form and mailed it to them, give it maybe a week to travel through the mail and to arrive at their desk, and then call DES at the number there, 800-888-3420, to be sure that they have everything they need to process your application. And it's an opportunity to ask them about how long the disability evaluation process is likely to take, because that varies according to volume and time of year, and maybe the complexity of your child's case and how much documentation you've provided yourself, which then means that they don't need to send written requests to the providers and wait for that documentation to travel back to them. So the medical records release gives them permission to contact the child's doctors for precisely this information. You want to complete one form for each provider, and don't just provide the agency, but name the healthcare provider that they can reach so that they know who they're asking for. And early intervention personnel or school personnel, especially school psychologists, are going to be appropriate releases to provide as well, because that piece about what is going on for your child in school is important as they make their determination. So you'll see on the application itself, but we're just reinforcing that sending any clinical documentation that you have to support what you wrote on the Child Disability Supplement is really helpful. And examples would be an IEP or 504 plan if you have them. Those are regarded as very strong pieces of evidence and documentation. Any hospital discharge forms or clinical notes from the doctors, summaries of evaluations and assessments. You wouldn't want to send your originals, but if you can make copies and send those to them, that will be helpful and it will expedite the process. And here are the application addresses. If you do the MassHealth application online, then there's no need to mail anything. It'll be submitted electronically. But on the right-hand side, you're going to mail the Child Disability Supplement along with the supporting releases and documentation to Disability Evaluation Services, known as DES, at that post office box. They're located in Worcester at UMass Medical Campus. So step 3 is going to be contacting premium assistance. And this is the final step that will help you to know whether it is going to make financial sense for your family to keep common health insurance. So after you've been approved for common health, DES will make its determination and they will notify MassHealth MassHealth will then send you a letter saying that you have been approved or denied for Common Health, and also telling you what your premium will be. And at that point, you want to call Premium Assistance at that number, 800-862-4840. I will say it can be difficult to locate the Premium Assistance number, so take special note of that, or you can always call us for assistance in contacting them as well. And once you learn from Premium Assistance whether they can offer you assistance through their program, and sometimes that can take 30 to 60 days, be aware of that. Premium Assistance, if you do qualify, is a benefit going forward from the time that they decide that you qualify, which means that some families might pay the full Common Health premium for the month or two while they're waiting for a decision from Premium Assistance. And so once you learn about your eligibility and the amount, you have 60 days to make a decision. Well, from the time that you receive the letter from MassHealth stating your eligibility and notifying you of your premium, you have 60 days from that point to decide whether you want to keep or cancel the policy. If you do decide to keep it, Common Health coverage is retroactive to 10 days before your initial application was received by MassHealth, whether electronically or in hard copy. So if you've received any medically necessary services in the meantime, those can be resubmitted to MassHealth. But do keep in mind that if you use the coverage or if 60 days elapse, then you've accepted responsibility for the premium. And again, these expenses must be medically necessary and provided by a MassHealth provider that also accepts your primary insurance, with the exception of CBHI services, sometimes ABA services, sometimes PCA services. Some of those would be exceptions. And you also are responsible to report any change in your income or residence or your primary health insurance to MassHealth. And so you can do that by calling customer service and following that path, or you can, if you have a username and password and a MassHealth account, then you can go in and make that update online. Our office provides information about MassHealth eligibility, the application process, the coordination of benefits with your primary health insurance, services that are available, and the associated costs to help families make informed decisions about healthcare financing options.
Okay, we have some questions now. The first one is, do you have to apply for disability evaluation services every year?
You don't have to apply every year, although periodically, once you've been approved, periodically there will be renewals or redeterminations. And if you receive a letter from MassHealth asking for updated information, then it's your responsibility to provide it at that time. Also, when children turn 19, they need to reapply under the adult disability standards. So you want to be aware as that date is approaching that they would be required to reapply at that time.
Okay, and the next question was, I went back and forth with Premium Assistance, and they said I was not eligible because I am on a health savings plan.
Oh, so I wonder if you were given that information in the past, because previously HSA plans were excluded. Oh, is this for Premium Assistance or for Premium Assistance? Previously, they excluded HSAs, health savings accounts. However, 3 to 6 months ago, we were informed that they were no longer making a blanket exclusion. And so you could call Premium Assistance and ask them if you could reapply.
Okay, bear with me for a few seconds. My computer has gone down and I can't see questions. We will get back to you very, very shortly.
You'll see on this last slide that we've provided our email and phone number. Kathy and I are either in the office or able to take phone calls remotely. So that's the call-in number or our emails. So feel free to share those. Oh, and also I'll take this opportunity to just remind you that our Joining Voices conference is coming up on November 3rd. It'll take place in Framingham, and it's a wonderful opportunity. We have morning and afternoon workshops. We really urge you to go on the Federation's website and register to join us on November 3rd. It's an all-day event. Lunch is provided. Kitty O'Hare is our keynote speaker this year from Children's Hospital.
Okay, thank you for waiting with us. We now have more questions. Does ADD or ADHD qualify as a disability?
The diagnosis in and of itself doesn't answer the question for DES. What they need to see is documentation of the ways in which ADD or ADHD results in a functional impairment, that it really significantly impacts the child's performance in school or in community settings. So those are the things that they would be investigating during their disability evaluation period, and it would be helpful to have both school and medical personnel to demonstrate the significance of those disabilities.
Any suggestions or advice for a child with mild issues, i.e. dyspraxia, developmental coordination disorder, and ADHD and learning disabilities? I don't know if he qualifies, but I would get more therapies for him if we had more money to do so.
DES will also consider the aggregate of disabilities. So if there's a collection of what a parent might term relatively mild, but if in some those disabilities result in limitations, then it would very definitely be worth submitting the application.
And another question, I applied for MassHealth online for my autistic son, and I was denied right away due to income. However, a week later, I received a MassHealth card in the mail with my son's name on it, with a letter that said I was eligible for Common Health, I believe. Do I still have to submit the written application?
Well, it is often expected that families will receive a denial when they apply for MassHealth standard, because that's based on a strict eligibility standard. Sometimes they, however, go on to issue cards for what's called the Children's Medical Security Plan, and to issue a card, it's really a bit of a red herring, and it's not what you're looking for. In the course of this application process, you might expect that you would apply for MassHealth and be denied based on income. And what's very important then is to go on to step 2, which is to submit the child disability supplement to be considered for Common Health based on the disability.
And another question, can you get PCA assistance?
You can. And if you were to do a Google search on the web to say MassHealth personal care attendance, you'll see that they have a very extensive guidebook on the web, including, I think, on page 6, the eligibility for PCA services. So you'll need to demonstrate the need for assistance with ADLs, and PCA services need to be evaluated and pre-approved through the agencies that would provide that care. So online you can find the guidance regarding PCAs, but the short answer to your question is that yes, PCA services can be covered under Common Health. And that information is also available on our website.
The next question is, in addition to a current IEP, can you submit medical evaluations that were completed more than 1 year ago with the application?
Typically, they're looking for information that's as current as possible. So ideally, it would be within the past year, but an evaluation that was conducted within the past 2 years, because with neuropsych, for instance, they don't recommend that it's repeated with too much frequency, or else it's not such a valid result. So if that's the most recent information that you have, certainly submit it. It's a case of the more the better, because you're just trying to demonstrate with the preponderance of the evidence. You want to make it easy for DES to agree that there's a disability that qualifies your child for common health. So it's never a bad idea to go ahead and include any documentation that you have.
Are there any other questions? We have some time left. Oh, here we have another question. Can you get coverage for social after-school program?
Typically, it needs to be a medically necessary service. So our PTI, the Parent Training and Information Center here at the Federation, is really good at answering and helping parents to access information related to school services and special education. So if you were to call the main Federation number and ask for the call center, by which they'll understand the special education PTI call center, they might be able to help you think about other ways to access after-school services. But that would not typically be something covered by MassHealth because it's not a medically necessary service.
Okay, we've gotten some more questions coming in. Does MassHealth Common Health cover any summer camps?
Again, unless it were shown to be medically necessary, typically it would not. But on the Federation's webpage, on the right-hand side, you'll see a link that's updated every year with a guide to summer camps, and it's by disability type. It's a wonderful resource for locating appropriate summer camps. And then sometimes Family Ties, another project of the Federation, can be helpful in finding funding for such programs, or they might be available on a sliding scale. Or perhaps some things could be accessed with the support of your school district. But those are typically not going to be covered by Common Health.
My child is about to turn 19. Am I too late to apply for child disability supplement?
I'm going to let Kathy answer that question. It's a tricky one.
So once a child turns 19, they are then eligible for adult disability common health. And the eligibility is different for an adult versus a child. So it's not as easily accessible. But once a child turns 19, then they need to reapply using the adult disability supplements. And the next question, can I apply in person for MassHealth? If so, are there portals? Will anyone help me?
So one avenue of access is that there is when you go on the Health Connector, there will be a line for enrollment assistance, so that if you have specific application questions, you could try that 800 number and see if the person was able to assist you. Another option is to go into one of the MassHealth enrollment centers, and there are 4 of those located around the state: Tewksbury, Springfield, Chelsea, and Taunton, I believe. You could walk into one of those centers, and we hear various reports. I think sometimes they'll give you an application and say, why don't you sit down over here, and start to fill it out until you get stuck, and then come and ask one of our assisters for help. And perhaps if, according to their availability, they might be able to sit down and assist you more. Another option is to, from the Health Connector website, look for the link for an enrollment assister, and you plug in your zip code, and that will tell you the locations where people are available by appointment to sit down and help you complete the application. Those are typically at health centers, community health centers, and hospitals. And so within your zip code, it will pull up an array of options telling you the distance from your zip code, and you could call those individuals, as it will remind you on the website, call to make an appointment to be sure that they'll be available. Because it's a 35-page application, it's typically going to take a good solid hour or more to complete the application, and so they want to make sure that they have the time to reserve for that, and they'll let you know what information you should bring with you. Another option, if you're getting just caught on a particular question, you certainly can call our office and we can try and assist you at Mass Family Voices.
You can also schedule a time with us to come into our office, and we will help you fill it out if that is needed also.
And we have some language, with advanced notice, we have some capacity to help with other languages.
So the next question, can I buy insurance through the connector and then apply for premium assistance? Does it have to be an employer?
If you purchase a, why am I blanking? Something that it already has a tax benefit, then it's considered subsidized and will not be eligible for premium assistance, a qualified health plan. But it's always worth calling premium assistance and asking them directly, because really the only way to know if you qualify, sometimes their eligibility standards change, and the best way to know is simply to call them. Sometimes they can give you an answer in real time. Other times they may ask you to submit to their application process, which involves you sending back an application as well as having the employer fill out a one-page application, and then they conduct a further investigation into the nature of your private health insurance. One valuable thing to know is that we've learned, to our dismay, that premium assistance does not have an obligation to inform families if they don't qualify for their program. So it's very important to be persistent with them. And I would say at the outset, ask them, when and how will I know whether we qualify for premium assistance? And really press them for specifics on that, or have the name of a specific person that you can get back to. Otherwise, that can be very frustrating. But some of the plans that are purchased on the Health Connector are not eligible for premium assistance because they're already tax subsidized.
Are there any other questions? We have some more time if you have any more questions. We'll wait a few more minutes. This webinar will be archived on our website at fcsn.org under Mass Family Voices. So if you want to revisit it and come back to see the webinar again, you'll be able to do that. We hope to get it up within the next 2 weeks. Following today's webinar, I will be sending out an evaluation on SurveyMonkey. Please fill it out, help us learn how we can do better on our webinars and what other topics you would like to learn about. Thank you very much and have a good day.